Hello, everyone. We managed. We are ready to go. Welcome. We are very, very happy to have you all here with us as we pretty much join the Humanitarian Networks and Partnerships Week beginning. Today, we've just started with the opening session this afternoon in Europe time. And this is one of the first sessions of this used to be a week, and now 3 weeks of internet and online conversations and events. We are extremely happy to have this session on mental health and psychosocial support, and more specifically on the role of the Dutch search mechanism that is allowing us to deploy mental health and psychosocial support experts all over the world when they are needed. I'm going to very kindly ask my colleague panelists to open their cameras if that's available to them. I have to let everybody know that some of our colleagues are joining us from, as it happens when you are dedicating your work to these difficult conditions where the internet sometimes is not the best. So we're going to do our best to keep all of our panelist colleagues with their cameras on. It might not always work too well, but we are all used now to our connections being better always. Let me first start introducing myself, as you're going to be hearing me talk for a little bit. Better tell you who I am. First of all, my name is Carmen Valle, and I am the IFRC co-chair of the MHPSS reference group for humanitarian settings or emergencies. I'm going to tell you more about the reference group of the interagency standing committee in just a minute. But before that, I would like to very quickly introduce all of my colleagues joining me today, and also to go very quickly over some rules, as we always ask in these kind of sessions with quite a lot of participants. We're glad that you are all here, but we're going to ask you all to remain muted unless you have a question or a comment. If that is the case, we will really encourage you to use the chat function, not only for questions, also to share experiences, comments. We'll be doing our best to track the chat. So please put any question in there, and we will be reading the questions at the end of the session. And you can also raise your hand if that's more comfortable to you. Having said these brief things, let me please introduce you to some of our colleagues joining us today. We are honored to be joined today from several countries. We have with us Ambassador Paul Beckers, who's the Special Envoy for Mental Health and Psychosocial Support in Crisis Situations of the Netherlands Ministry of Foreign Affairs. Ambassador Beckers, we're really happy to have you with us today, and we will be having your participation in our panel. I'm also joined by my wonderful co-chair. The reference group, as I'm going to explain in a minute, is co-chaired by the International Federation of the Red Cross and also by WHO. And on the side of WHO, we have Dr. Fahmi Hanna, who is a technical officer at the Department of Mental Health in the headquarters in Geneva, and is also, of course, the co-chair of our reference group. Fahmi, thank you so much for joining us today. We have with us as well Teresa Ombalo. Teresa Oteri Ombalo is a mental health psychosocial support expert based right now in Kakuma in Kenya, but she's been deployed in many countries, and she's going to share her experience with being deployed with this specific mechanism we're talking about today later on. Teresa, thank you so much for joining us. It's really good to have you. We also have Sandra Katz, who belongs to the Netherlands enterprise, who is part of the big effort that we're doing to deploy it. I think I can't see the camera on of Sandra, but she is with us. There you go. Sandra Katz is joining us from the Netherlands, from the government of Netherlands as well. So all of us are going to be introducing to all of you something that some of you are because I can see some of my wonderful colleagues from all over the world joining us today. Some of are more familiar with these mechanisms, and some others might not. And I think we're very interested in in showing this incredible development in just a year, what has been achieved through this Dutch SET support, which is allowing us, as I was saying, deploying colleagues where they are very needed. I would like to first of all start maybe with a very brief presentation on the reference group. So these mechanisms we're talking about today, this search capacity that we have, is a joint effort of the DSS, the Dutch Search Support, which is funded by the government of the Netherlands, and the Interagency Standing Committee Reference Group for Mental Health and Psychosocial Support in Humanitarian Settings. And this is what I would like to first of all maybe introduce to our audience. Allow me to please just very quickly share my screen. Here we are. This is the one. And of course, make it expanded. There we are. So I just wanted to, sorry, let me go to the beginning. I just wanted to give a very, very brief overview because I'm very interested in hearing what my colleagues have to add to the session today. So just very briefly to let those who might not be familiar with the reference group about what we do in this reference group. I would like to start by saying that we and the mental health and psychosocial support community have a very clear goal. Our overall goal, what we really want to achieve in humanitarian settings, is reduce suffering and improved mental health and psychosocial well-being of those populations that are being affected by several emergency settings. The Mental Health and Psychosocial Support Reference Group in this regard is an associated entity of the Interagency Standing Committee and is allowing us to bring together really all actors, all agencies and organizations that are developing and they are really the ones delivering these mental health and psychosocial support programs all over the world. So just very briefly to let everybody know that it was back in 2007 when the guidelines for mental health and psychosocial support in humanitarian settings were written. This was a very important development because it allowed a very complex, very diverse field of expertise to be very harmonized and to allow organizations to all do a type of response that is of high quality, that it's responding to the greatest needs in the field, but it's also very well aligned, very coordinated, and it allows us all to be doing more or less the same things in terms of quality and in terms of evidence-based. So since that, the written of those guidelines, it became very obvious that what was needed was not just the guidelines, there was a need for a bigger coordination effort, for having more capacity to connect among agencies and to be able to connect the global developments in mental health and psychosocial support with the country level implementation. So ever since the reference group was established, and it has been co-chaired in the past by the Psychosocial Center of the International Federation of the Red Cross, who I belong to, and UNICEF, and nowadays is co-chaired by ourselves, IFRC, and the World Health Organization. We have 4 very specific objectives that we work towards. One of them is to make sure that we work with all of the cluster system, all of the clusters in emergency settings, health protection, food distribution, all of them. We have a very clear objective around supporting coordination at country level, where something happens and there's a coordination mechanisms being established, so organizations responding can be well aligned and well coordinated. We have a very strong goal on advocacy. I think we all have heard more and more in this past year of this terrible pandemic crisis. We've heard more and more about mental health and psychosocial support, but it's been a very long road of advocacy to make MHPSS, mental health and psychosocial support, visible and to make its importance clear to all actors. They need to contribute. And of course, we have a main goal in liaising and working together with the Secretariat of the Interagency Standing Committee. And what we do is just we work through when my colleague Fami and myself co-chair this group, we basically are just two enablers of all of this vast group of organizations that belong to the reference group that I'm going to refer to in a minute. And it's all of those organizations and their members who are allowing us to develop and implement our work plan, which is just coming together around these main activities that you can see on the right hand side of the PowerPoint, working, as I was saying, with the country level technical working groups, being able to have this search capacity we're talking about today, but of course developing a lot of tools and resources, guidelines, and other very important publications that can be used by colleagues all over the world, as well as in making sure that MHPSS is well integrated in humanitarian actions and that specific populations, especially those more at risk, are not left behind. So at the moment, the reference group has 60 full members, organizations developing and delivering mental health and psychosocial support, 11 observers, and 10 donor organizations. And this big group of these 60 organizations, these observers and donors, we together work very strongly through the co-chairs in bringing the global and the country level together. And I think this is a very essential part of what we do. What we aim in the end is to provide better response. So the essence, the core, the most important part of our work is definitely our colleagues at country level, those who are nowadays, every day, developing and delivering mental health and psychosocial support programs in very, very difficult contexts. So all of us just work around that need and try to provide as many tools and support as possible. Just to give a little bit of an overview of how these working groups are at country level, for those who might not be too familiar with mental health and psychosocial support, our area of expertise is an area that we call it a mainstream area. We are not sitting in any specific part of the humanitarian response. We are not health, nor protection, nor education. We are all of it. You can only achieve the mental health and well-being of those who need our support if this response is integrated across all of the sectors, because mental health and well-being, and the reason why we say always mental health and well-being is because it's a very large spectrum, from those who might need very specialized services because they might be suffering, for example, a mental health condition, all the way to just the regular well-being of the population who under a humanitarian crisis are going to obviously be affected in their well-being, and they're going to need the environment to respond to those well-being needs. So at country level, we have the valuable work of the technical working groups who connect with all of these sectors and ensure that the mental health and psychosocial support needs are integrated in all of these other parts of the humanitarian response. So in that regard, there's a lot of coordination needed, and there's a lot of work being done in the country to make sure that mental health and psychosocial support is an integrated part of any humanitarian response. From the reference group, we're going to support that work, doing global calls when a new humanitarian situation happens, and this initial very well coordinated response is necessary. We're going to make sure that we bring everybody on board on global calls, but then we do follow-up calls, we provide technical support, and of course we listen to the needs from the field to respond with guidelines or other documents, as I was mentioning before. I'm not going to go into this, but I just wanted to show this providing guidelines, this doing coordination. We could, for example, show it through the COVID response as the most recent one that we've done. Only in that response, we've been doing several global calls to bring everybody together to make sure that all organizations are responding to COVID in a coordinated way. We've been supporting country level groups, and we've been producing these resources that in a minute I'm going to share a link on the chat where you can access all of them, that can be used by MHPSS experts all over the world, and that are the joint effort of many experts belonging to many organizations. And I think this is a very powerful part of the reference group, is that it publishes things on behalf of the entire humanitarian response, the entire humanitarian MHPSS actors. So as you can imagine, it's a lot of work, but it's very, very needed and very interesting. I'm going to copy another link in the chat so you can see what we've been doing, for example, in 2020, just an overview of achievements. And that's going to allow you to read a little bit more of what we are doing. But before sharing those links, which I'm going to do in a minute, the reference group has been existing, as I was saying, for some time already, and it has not always have this capacity to deploy experts to the field. So I would very much like to pass on to my colleague Fahmi, so he can let us know how is it that we ended up deciding that we need a search mechanism, and how did it happen that it became a reality. Over to you, Fahmi.
Carmen, thank you so much for the excellent overview. If you can share my slides, please. Carmen, thank you. If you can share it through the slideshow so we can see the full slide, please. Perfect. Thank you so much. Colleagues, the interagency mental health and psychosocial support surge mechanism was launched in 2020. But the journey to reach the launch in 2020 has started many years before that. Let me share with you through these pictures how it all started. Between 2015 and 2016, UNICEF colleagues who were co-chairing the IASC reference group commissioned a review, an evaluation for how the mental health and psychosocial support guidelines is being used and implemented in different humanitarian settings. One of the key findings, one of the key recommendations that came out of this evaluation is the IASC guidelines is well known widely. The term mental health and psychosocial support is being introduced in all humanitarian settings. But the key gap was having a pool of experts for rapid deployment whenever an emergency happened. Having specific expertise in the area of mental health and psychosocial support to establish country-level MHPSS technical working groups and respond rapidly to emergencies. Unfortunately, one of the findings from this 2015-2016 evaluation of the IASC guidelines that it takes very long time in emergencies for MHPSS technical working groups to be established. In the annual meeting of the IASC reference group of 2015, 2016, and 2017, the surge mechanism was on the agenda. Between 2016 and 2017, IFRC, together with UNICEF, my good colleagues Marguerite Blau and Sarah Harrison, has conducted a review based on all available documentation for all surge mechanisms in all sectors and in all clusters, what's published and what's there in gray literature. And then an interagency meeting by the MHPSS reference group was convened in Amman. You can see one of the pictures from that meeting. This meeting was about knowledge exchange about surge mechanism. We invited all colleagues, those who work on GenCap, on ProCap, in standby partner mechanism and health clusters, in protection cluster and gender-based violence, all who run OCHA colleagues, all those who run surge mechanism in other areas. The idea was to learn as MHPSS from what has been implemented and update our knowledge and information and start to propose some models for the reference group members for how to go forward. We came with key set of recommendations from 2018 meetings. I'm going to come later to that, but I want to share with you also the context where all this is happening. 2019 came and there was a global summit that was convened by the Ministry of Foreign Affairs of the Netherlands, bringing mental health and psychosocial support in emergencies at the forefront of the policy discussions about humanitarian practices. This conference really set up the scene for an IASC principals meeting that was conducted in December 2019, where MHPSS was seen and reaffirmed as a cross-cutting area that was even, again, reaffirmed in a joint interagency call for action by all heads of agencies in 2020, in the same call for actions and the same IASC principals meeting in December 2019. MHPSS reaffirmed as a cross-cutting area, and support to country-level MHPSS technical working groups was emphasized. Next slide, please, Carmen. Thank you. Again, showing the context where the surge mechanism was coming. In 2020, with the launch of surge, in March 2020, we had only 22 country-level MHPSS technical working group in humanitarian setting. But COVID came, and the needs in countries increased. And we found by September and in January, more than twofold increase in country-level MHPSS technical working group. From baseline of 22 countries, we have 53 countries. So the needs in countries has been more than doubled. For the first time, mental health and psychosocial support was recognized in the Global Humanitarian Response Plan with monitoring indicators. And the monitoring indicator was counting number of functioning MHPSS technical working groups in countries. WHO recognized mental health and psychosocial support as an integral component of COVID-19 and other public health emergencies response. And the United Nations Secretary General had a policy brief on mental health as an essential component of COVID-19 response. So the surge was coming really with the whole global humanitarian system, emphasized the need and importance of MHPSS technical working groups coordination. And again, the number of country level groups has increased. Next slide, please. So back in the 2018 meetings, the key recommendation was not to establish a new structure. Many ideas came through that meeting. Some colleagues was discussing that we should develop even a new organization, a new secretariat within the reference group to have surge. But we learned it from the IASC MHPSS guidelines that we should build on existing structures. So the model that colleagues selected in the Amman meeting in 2018 was to look for an existing standby partner mechanism where the IASC reference group can partnership and can collaborate to establish an MHPSS surge mechanism. So the IASC reference group, starting after the Amsterdam conference and after the Netherlands prioritizing MHPSS for the whole humanitarian system, to talk with the Dutch Enterprise Agency, RVO, for having a partnership, having an agreement, where the DSS will play the key role in building the database of experts, contracting the experts, covering their fees, the cost of their deployment, the cost of their travel, covering their insurance, and also covering mental health and psychosocial support for the deployed experts as part of their contract and agreement, and covering memorandum of understanding with different organizations. Currently, there are memorandum of understanding with WHO, with UNHCR, with IOM, with UNICEF, and with Action Against Hunger. The role of the IASC reference group is the link with country-level MHPSS technical working group, which play a key role in interagency coordination of this area of work at country level. The IASC MHPSS reference group co-chairs review the terms of reference from technical aspects. They provide support and mentorship for all the deployed experts in the field. Most importantly, this area of work lack human resources. So one of the key roles that the IASC reference group play is mentorship on job capacity building and also doing training courses for the deployed colleagues or colleagues in the database to build their capacity on MHPSS coordination. This whole mechanism is funded by the Ministry of Foreign Affairs of the Netherlands, to whom we are really grateful for establishing this mechanism. Just for you to imagine how the picture was looking like in 2017, when I joined the reference group as the co-chair, the only surge mechanism we had at that time was by deployment of the two co-chairs. So in 2017, 2018, 2019, the average numbers that the co-chairs would travel would be 10 to 12 missions a year, each of the co-chairs. While we were happy to do so because it's our job, but it's not sustainable mechanism. You cannot rely on covering the whole world with this number of emergencies on two experts. You will learn more about how we were able to expand from only 2 people covering the search into actually having a pool of experts. I hand back to you, Carmen.
Thank you so much, Fahmi, for that presentation. And indeed, it wasn't. I mean, I wasn't a co-chair at that point, but I very much know the previous co-chair, and I'm not sure how you managed to cover so much, and how wonderful it is that now we have the capacity not to do it 2 people, but to actually have this vast group of experts who also bring other things, other ways of doing things, other knowledges. So it's definitely a much more reliable and a much more sustainable way. I would love to hear from Sandra, who's also joining us from the Netherlands. How is the mechanism working at the moment, and what's the DSS structure? How do you manage the search mechanisms that we have? Over to you, Sandra.
Yes, thank you very much, Carmen, and also Fahmi, because now I was listening to Fahmi, and he was so enthusiastic that I can skip half my presentation, but that's fine. So we can listen to the experts from the field, which is much more interesting. Carmen, if you would like to share the presentation. Basically, we call it the Dutch Search Support for Mental Health and Psychosocial Support. And it's a rapid response mechanism to support countries with their psychosocial, mental health and psychosocial support system. If you want to go to the next slide, Carmen. Basically, what do we do? We're a search support, which means that we are trying to deploy people rapidly. Rapid is a large word, because it depends very much on visa procedures. It depends very much if the country is ready to receive the people. So it's not just us being trying to speed up things, but it's also the ecosystem around it. What do we have? We have a database, and at the moment we have about 200 people in the database, which are suitable for deployment. Of course, you can have a very large database, but people still need to be available, and availability is always a big factor. Also, what we do have is people who speak different languages, who have different capacities. For the moment, most important are languages and coordination skills, because we don't deploy people for the moment to individual organizations for their operations as such. So we really try to connect to the coordination mechanism in these countries. Then we have already experts. We have standby partnerships from with the various UN agencies, and also some NGOs, and as Fahmi was saying. However, why do we need these standby partnerships? It's basically we are responsible for everything as a Netherlands government. We are not in the field, so we need the organizations to secure the safety of the deployees to be in the field. And that is very important for us, because if you are safe, if you feel safe, you can do your work much better. Then we also try to meet the needs and the expertise that we have. Sometimes we get a request and we feel that the TOR is not what it should be, or we do not have the expertise available. Then Carmen and Fahmi step in, and they go and discuss with the country and see what they can do to actually get the right question, so we can basically meet the need. Then we also, one of the key topics is also to actually meet the advocacy needs that are there for MHPSS. As Carmen and Fahmi were both saying, is very much needed to put MHPSS on the agenda in these crises, and it's not part of the structures. So this is what we do, try to show organizations with the experts that we send out to the field that it's a very important topic. Carmen, could you slide through? So how do we operate? We have partnerships with the standby partners. We have the Ministry of Foreign Affairs, who is actually our donor. And the Netherlands Enterprise Agency, don't feel tricked by the name. It's actually also, we do not only support enterprises, we also support the development sector as such. And we also do humanitarian programs. And we work together with the reference group because we don't have the expertise in-house on MHPSS. So this is where the where the cooperation came from. Carmen, if you slide through a few times, then you can see more pictures appear. Thanks. And of course, we're deploying to all countries around the globe where the need is highest. Then the next slide, please. Yes. So I said we have partnerships with the various organizations. We have more partnerships. However, these 6 that we have here, they're basically, we have signed, especially on the MHPSS topic as well, but we can use the other partnerships that we have with other agencies as well. We are part of the Standby Partnership Network, which is quite important because as a program, we are not here to stay forever. So what we really like, and this is also why this session is very important, that others are going to take over. So if you're part of the Standby Partnership, or if you are an agency who would like to deploy more experts on MHPSS, then please feel free to do so. And we're very, very open to cooperation, or let you show how we do it, and you can for sure take over, not a problem. Then for the next slide. What services do we have? So Family was already mentioning most of it. We have an MHPSS network. We have a daily tariff, which is not that high. And it means that you have a consultancy contract with us. So this is something that it's very important to know, because we've had a few examples that people didn't know upfront what the conditions were. So it's always good to inform upfront how we work. It's all on our website as well. You can find it later. We have an insurance for the people who are going to the field, which is quite important, because as an individual, it's very difficult to get these insurances, but because we are a government agency, it's more easy because we have a backup system. Then we also, of course, do medical checks, which is important also with the COVID situation now. However, we don't want to not support the field because it's so important. So we do still try to get healthy people into the field as much as we can. Of course, support for the people themselves, personal support, as well as psychosocial support, as well as expert support. And the expert support comes from Fami and Carmen. Then, of course, we have some training modules. We just had one on last Friday, on the code of conduct. But we have other trainings as well. So also, if you're interested, please subscribe to the database and you get all the information also on trainings. Next one, Carmen. Yes, so how does it work? If you really want to engage people in the MHPSS sector, you can just send a request to us. A TOR is enough, and then we start discussing whether we can fulfill the need, or if we have to change the TOR. So please contact us whenever you feel that you need someone for the coordination or for the on MHPSS in your country. Very good to know that the maximum duration of our deployments is 3 months, because it's gap filling, it's search, which means that we don't deploy people for like a year or something like that. But sometimes you can just start up your operation with a person for about 3 months, and then you can continue with your own funds, and you have 3 months to search for a capable person to follow up. So the last slide, I think, is to show you some facts and figures. So what have we been doing? We've had 10 deployments so far in the various countries. Currently, we have 8 experts in the field, and I saw some of them also joining this session, so that is very good to see. Then we have 3 deployments in preparation, and these TORs have been shared, so people are at the moment they're able to apply to this request. The female-male division is about 50%. A bit more females we can use maybe, but depends very much on needs and the request. Then the trainings, I already said that we organized some trainings. Online training we've had in July, which was mainly about coordination skills. And we are going to do one again soon, but we were hoping to do it live. I think we'll have to go for digital again, but it's coming up, I think. And then we have done a training on child protection and also 2 trainings on the code of conduct. And yeah, that's all from me for now. I would like to hand over to the experts from the field. And please, if you have any questions, contact us at the website or by our mailbox or give us a call. Thank you.
Thank you so much, Sandra. And that was an excellent overview. And for many of those who were having questions around and what else, I want to know more, my colleague Fahmi just shared in the chat. If you could scroll up a little bit, you'll see it coming from him with a link to the DSS mechanism where you can register yourself as a professional and join the pool of experts or get more information. And I think this, clearly for all of us, this information is very interesting, but there's nothing like hearing for those who actually do these deployments to know if something is important and relevant and if it's working well. So I'm really, really glad that we have Terry with us today, Teresa Ombalo. She is now in her 2nd deployment from this same mechanism, one with WHO, the other one now with UNHCR. Terry, we're super happy to have you here today, and we would like to hear from you, your experience and how it has been to work with us so far.
Thank you, Carmen. Thank you, colleagues. Good afternoon, good morning, wherever you are. My name is Teresa Ombalo, or Terry. Yes, so this is my 2nd deployment with DSS. My very first deployment came last year, March. And as you've had Dr. Fahmi mention when we started the deployment, now I'm just realizing I probably was among the first people to be deployed under MHPSS. So I started in March of 2020 in Addis Ababa, Ethiopia, and I finished that deployment in September. And I was hosted by WHO, quite some interesting times. I was on mandatory quarantine that was instituted by the government. So that was quite an experience to be able to go through that because I was able to support other colleagues who are going through the same. And then most recently, beginning January, around the 20th of January, I joined UNHCR in Kakuma refugee camp in the northern part of Kenya, still supporting with the coordination of MHPSS activities. My experiences have been quite good, I would say, for both deployments, both in Addis Ababa and also in Kenya. One of the main things I would say probably how these deployments are really helping is that it helps to have one person or a person dedicated to support MHPSS activities. Like Carmen had mentioned, MHPSS is quite cross-cutting. We are not a standalone cluster. We're not a standalone sector. We work through the other clusters within the humanitarian response. So it's really important that there is somebody who's always there speaking about mental health and psychosocial support. And towards this, I would say, particularly when I started my deployment in Addis Ababa, I arrived when mechanisms were just being put in place for COVID response. And at that point, MHPSS had not been included as part of the response pillars because they didn't have somebody dedicated for that to that function. But I arrived and I was able to work with my colleagues, and MHPSS was included as part of the response mechanism, and were able to update and support the government in the response, as well as all the other agencies that were doing the COVID response in Ethiopia. So I would say that was we were only able to achieve that because there was somebody that was dedicated to do that function. Otherwise, we find that a lot of MHPSS work and activities gets pushed behind the banner, gets put in the back burner, and we are not quite able to bring it to the forefront as it should. And I think with COVID and all the other recent emergencies, all of us have learned the experience, at least I'm hoping we have learned importance of having mental health and psychosocial support in our responses. In Kakuma, for example, because of the freeze in the resettlement for refugees and so many other issues and COVID in the camps, there has been a lot of frustrations among the refugees. And you find that without one person dedicated and collaborating with others to speak about mental health, it's really not possible to meet those needs. And with that, we are then able to work with other sectors. For example, here in Kakuma, we've worked with communication with communities, we've worked with health, the health sector, to just be able to really speak into the issues that are frustrating the refugees, issues that are revolving around suicide, why so many of them are taking their lives. You know, those are issues that we are now addressing and bringing to the forefront and saying, hey, it is just not people that like there are drivers, there are things that are making people resort to that, and what can we do to be able to support people in such difficult times? And I think that's only that's only possible because of having somebody who's constantly speaking about mental health and psychosocial support. And I think also having somebody dedicated to this function kind of helps to ensure that whatever activities are initiated or organizations speak about, they're actually held accountable in a good way, so that we make sure that they're actually achieved when organizations are speaking about mental health, provision of mental health for their beneficiaries, or provision of mental health for their staff. What exactly are they doing towards that? And as a working group, we are able to really work with organizations and say, yes, as much as you're supporting the people of concern, or you are, then there's also need to support your staff so that they don't experience burnout and they're able to provide services longer. I see this as a great opportunity, especially in these times, to provide clear structure, to understand exactly when we talk about mental health and psychosocial support, what are those things that you are talking about? And I think this comes clearly when we have an opportunity to do, for example, a mapping of partners, to know who's doing what, where, to whom, when, you know, so that as we are supporting people within our care, we are also able to refer, because we also have to recognize that we might not have all the capacities to meet all the needs. So how do we refer? By only being able to know what every one of the organizations on the ground is doing. So those are some of just the specific activities that we do and that we support with when we're in the field in terms of psychosocial, mental health and psychosocial support. Having said that, there's quite a lot to do within mental health and psychosocial support. As you can imagine, working with a human being is not like working with a machine where you bring in a spare part and you start the car and it's ready to go. You know, with a human being, it has to be something that you have to engage over and over and over again for you to have any breakthrough. So yes, we understand that the deployment mechanism is a short-term, 3 months, but also I would encourage that within those organizations that have expressed the need to have a deployee, that you also work within those mechanisms to ensure that whenever the deployee's time is up, there's somebody stepping in those shoes so that a gap is filled. The worst thing I think that can happen is to set up mechanisms and get things going, and then when the deployee steps out, then everything comes at a standstill, because it's like you've asked the curiosity of people. People are interested, people are beginning to trust the process, and then now they're being left hanging. So really, let's have like a stopgap measure and a way to continue to provide services that we have identified as are needed in the communities that we work with. So yeah, I think what I would say, it's been a good learning experience, both in Ethiopia and also here in Kakuma in Kenya. Over to you, Carmen.
Thank you so much, Terry. It's so incredibly important to hear what the experience is. And as you're highlighting, not just your experience as an expert being deployed, but what great need there is to mental health and psychosocial support services in country level. We're grateful that the MHPSS field is expanding and is getting recognized, but as the other participants were saying, this has started to happen thanks to a lot of advocacy and work like yours in the field. There's still so much to do, and on that note, I would really like to hear from Ambassador Bekes. We've seen definitely a massive increase of interest in MHPSS. We know the needs are large. We are very grateful to the government of the Netherlands on the support, not only in giving it visibility and bringing it up front in many important events, but in funding mechanisms like this one. And I would like to hear, why is this of relevance for the government of the Netherlands?
Well, thank you, Carmen, and good afternoon, everybody. Good to see some familiar faces, of course, Dr. Fahmy, Sandra, and I know people that I can't see, but are on the but connected with us as well. By the way, Carmen, you would really do me a favor if you would also use my first name, because I feel kind of excluded from this group otherwise. First name is Paul. Thank you, Carmen.
Paul, over to you.
Thank you. Yeah, a couple of things, but to answer your question, maybe best is to look at the bigger picture. I mean, as a Netherlands government, I think people know we really firmly believe that integrating mental health and psychosocial support in humanitarian aid is essential for people to rebuild their future. And therefore, it's a top priority in our policy, which started by the leadership of Minister Sigrid Kaag, but which continues to be at the top of our list. And we were very happy to see an increase of support by others. It was sort of a global development. At the same time, we recognize that there's a lack of coordination of the response, also lack of volume and of quality of services, but the coordination was really lacking. So when, and Fahmy elaborated on that, when there was this meeting of, I think it was 2018 in Amman, the IAS reference group members met, when it was stressed to have the need for a surge capacity for MHPSS in humanitarian settings, humanitarian aid. For us, it came sort of natural to jump in. And by the way, when I say us, it was before my time, but I know there's a couple of colleagues and friends actually who are also connected with us. I saw a message in the chat of my good friend Jelte van Wieren. My colleagues then decided with the government, with the minister, to jump in. Not only because we saw this need, but also because we had a mechanism in place, different topic, but a ready-made mechanism and expertise with a search mechanism for water. I wouldn't say it was a copy-paste, but it made it a lot easier to set up and to help assist for an effective mechanism. I must admit, and listening to everybody, which was highly enlightening, thank you. Knowing that there was this need, knowing when we set up the mechanism, I think none of us did foresee that the mechanism would be such a success. We initially thought about 5 deployments in 2020, but it ended up with 17, 13 plus 4 extensions. And we're talking about, well, Teresa mentioned Ethiopia, Kenya, but Yemen, Albania, Peru, well, I think Burkina Faso as well, a wide range. So it was a surprise, a good surprise, because we thought it really addressed the needs that are there. But then the government, of course, had to make extra funds available as well. And yes, the COVID response also had an influence. It made the demand increase. Yeah, so looking back, I see a couple of observations. What we see is that I mentioned the lack of sufficient coordinating capacity. I do believe, or we do believe, we address this in part by having this mechanism. But it also had some other effects, like having organizations realize that MHPSS indeed is a value added to their response, to their interventions. And I think it was actually Teresa who just commented on the 3 months period, and also Sandra did before. We're very happy to see that the search positions for 3 months actually are taken up, or I think Sandra used the term embedded the experts in the organizations, which I think is very helpful. And this happened in Ethiopia and Burkina Faso, which implies that MHPSS is given the much necessary attention. So yes, we're very happy to be a partner. Yes, we are funded, but we're definitely a partner. Altogether, we make this happen as a partner. Now, one more remark is that I think Teresa mentioned challenges. And I think it's good to also address our challenges, the ones we had together with Sandra, together with the DSS. Going back to the 3 months, there was a point in time that we thought maybe we should extend the 3 months because apparently there was a need. But I'm happy we haven't, because although the finances are maybe substantial, they're limited. And the implication would be that you have longer contracts, longer experts being in place, but on the other hand, much less. And that would be really a pity. And we have to realize that part of the success of the mechanism is the fact that it's a short-term rapid deployment. So I'm grateful for the partners who have kind of addressed this by embedding experts in the organization. Yeah, that's pretty much, I hope that answers your question. And it's clear, but I'll just follow in other speakers' footsteps, that we call on others to follow suit. We want to see more deployments in the future because it's very important, but we want others to partner with us, fellow governments, other partners, foundations to jump in to make this all happen. So thank you. Back to you, Carmen.
Thank you so much, and especially for finishing on that note that we all very much want to echo. We need more partnerships. We need more voices and more organizations backing up, and we need more funding. So it's always very important that we all come together. And I think the good thing is that initial part of proving, as yourself and Teresa were mentioning, proving with each deployment how good it is, how deployments can support, how also mentioning a comment in the chat, beyond that initial deployment, how do we maintain more work at country level? Is these deployments and the work of the technical working groups at country level that is showing how valuable mental health and psychosocial support is to the entire humanitarian response. So hopefully we will continue having more support to these activities through even more partnerships. So calling on partnerships. I'm very aware of time, and I would like to have the opportunity to respond to some of the questions. Some are being responded immediately in the chat, which is very useful. Thank you, Brandon, for responding to some of them. But before we go to the questions, I just would like to note that one of these technical working groups that are being supported right now by a deployment, the one in Afghanistan, the technical working group in Afghanistan, the colleagues are also joining us in this call. So I would like to give a very brief second to our colleague Nadia from the technical working group in Afghanistan. She is employed by Action Against Hunger, and yeah, I can see you here. Would you like to make a brief comment on the MHPSS in Afghanistan and the deployment right now?
Thank you very much, Carmen, for the opportunity to discuss with the colleagues about the third and also need of MHPSS in Afghanistan. After almost 40 years of conflict, crisis, and emergency, the vast majority of Afghan population suffer from some form of psychological distress. The population of Afghanistan is very much exposed to traumatic events. The result of Afghanistan National Mental Health Survey showed that 85% of the population either personally experienced or witnessed a traumatic event in their life. Almost 1 out of 2 Afghan is suffering from psychological distress, which is 50% of the population. 12% of Afghan population has ever asked for help for mental health problems. Besides, training is identified as a major challenge. There is limited funding for trainings. There are also challenges in terms of referral, monitoring, and evaluation mechanisms. There is lack of knowledge and understanding on proper referral process, lack of harmonized referral tools, and lack of follow-up of the referral cases. DSS supporting is matching perfectly these gaps, and they are meeting the needs on time. Training and workshops are valuable because they are perfectly matching the needs identified by the MHPSS working group as their training priorities. The MHPSS working group has coordination meeting with IC reference group co-chair, and they inform the MHPSS working group of the DSS mechanism. DSS mechanism supported the MHPSS working group by recruiting MHPSS specialist Brandon Gray to support the NGOs to build their capacities at specific areas identified by them during training need assessment conducted by MHPSS working group. So we are really thankful to the Dutch support efforts for Afghanistan MHPSS working group on time support. Thank you very much, Carmen. Over to you.
Thank you so much, Nadia. Thank you for the very important work that you're doing in such a complicated context as the Afghan one. We follow very closely all of your activities, and it's impressive to see. And glad that Brandon is also joining us. As you mentioned, he's deployed right now in the country through this mechanism, and this is what we're being able to do at this moment, from longer interactions are the ones from Terry to very specific. We need this training. We need somebody to come and do this training for all organizations responding in the country. And Brandon, in this case, have been able to go there and provide these trainings. I'm afraid we're running out of time. There's a few very, very interesting questions in the chat. My suggestion would be, we do have your emails because you're registered through the Zoom link. We would be very happy to take a little bit of time on going through the chat, looking at your questions and getting back to you over email. I hope that is good. We would love to spend another half an hour responding to your questions, but unfortunately, many have to go to the next sessions on the Humanitarian Networks and Partnerships Week. So I'm going to finish with something very, very, very important that I don't want to forget, also because it relates to some of the questions that were being asked about COVID, and is that we have this other session that I'm sharing in the chat. We're going to have a session to discuss more in detail what the reference group is being doing to respond to COVID and the mental health needs of COVID-19. So there you have the link to register to that other session, which is this coming 21st, it's Wednesday, at 3 p.m. So hopefully see you there. I would like to once more say thank you to Terry, to Paul, Fahmi, Sandra. Thank you so much, Nadia and Brandon as well, for joining us. And thank you everybody for joining us and learning a little bit more about mental health, psychosocial support and search. Have a lovely afternoon, rest of the day. Thank you.
Thank you very much.
Thank you, Carmen, and thanks everyone.
Thanks
Thank
a
you
lot.
all.